صباح الخير عليكم. Good morning everyone. This is going to be our third session on Autacoids. Last time we finished with the angiotensin converting enzyme, and we said this enzyme is rate limiting enzyme in the activation conversion of angiotensin 1 to angiotensin 2. قلنا الانزيم ده مهم جدا، موجود في الكابيلاري endothelium especially in the lung. It has many names: dipeptidyl carboxypeptidase, which is a chemical name derived from its action. It's a peptidase enzyme because it splits amino acids away. As you've seen, احنا شفنا ان هو it converts the decapeptide angiotensin 1 to an octapeptide angiotensin 2. That's why it's called the peptidase at the carboxy group, and because it's splitting two amino acids, it's called dipeptidyl. So dipeptidyl means that it's going to split two amino acids. فهو فعلا it converts the decapeptide to an octapeptide. Another name is kinase 2, and if you can remember, it has the name kinase 2. ليه كان الاسم kinase 2? Because it inactivates bradykinin, which is one of the kinins. Okay, so it activates the bradykinin, it inactivates bradykinin. In the meantime, it activates angiotensin 1 by converting it into angiotensin 2, and it inactivates bradykinin. It produces a vasoconstrictor and it inactivates a powerful vasodilator. اوكي طيب it metabolites other autacoids. قلنا bradykinin وكمان substance B ممكن يبقى metabolized B. وال ACE inhibitors include captopril, lisinopril and enalapril. طب يا ترى captopril والlisinopril والenalapril ديت لما they will inhibit angiotensin converting enzyme ده معناه ايه؟ They will decrease the production of angiotensin 2, so they will decrease the vasoconstriction, they will decrease the production of aldosterone, so they will decrease the blood pressure. they are used in treatment of what؟ هيستعملوا في ايه بقى captopril, lisinopril والenalapril in the treatment of hypertension. حد يقول لي طيب ما هو in hypertension they will prevent the kidney from its perfusion. I tell you no, because patients with hypertension have a reset of the blood pressure. The blood pressure is reset at a higher point. اوكي هم عندهم الريجوليشن اصلا فيه مشكله، ان هم متظبطين على blood pressure اعلى من اللي مفروض، ف they need to get their blood pressure lower, and we can do that by any mechanism because we don't know the real cause of the hypertension, so we need to work around it ونستعمل اي mechanism علشان نقلل ال blood pressure. So captopril, enalapril والlisinopril are drugs used for treatment of hypertension through inhibiting the angiotensin converting enzyme. And again, when we're revising now the mechanism of action of the angiotensin 2 through angiotensin 2 receptor, two vasoconstrictor actions, one direct through its receptor, one through the stimulation of the sympathetic nervous system, release of catecholamines, release of two hormones, ADH and aldosterone with salt and water retention, two actions on the heart, mitogenic action and positive inotropic action, and again negative feedback on renin secretion, which decreases, and on the CNA and on spasmogenic effect on smooth muscles. It also results in increased ACTH production. Type. How can we inhibit the renin-angiotensin system? As you can recall from the diagram that we had on the last session، كان في diagram مبينينه on the last session، ده اللي كان فيه اليالو بوكس اللي فيه الانجيوتنسين converting enzyme. ده كان بيقول لنا ان انا I can inhibit the system by inhibiting angiotensin converting enzyme. اوكي، او انا ممكن to block the angiotensin 2 receptor by angiotensin 2 receptor blockers. So I can have an ACE inhibitor زي captopril, lisinopril and enalapril، أو to block the angiotensin receptor by losartan, valsartan, candesartan and telmisartan. So as you can see, any suffix lapril or pril, this stands usually for an ACE inhibitor, angiotensin converting enzyme inhibitor. However, if we get a sartan, losartan, valsartan, candesartan, telmisartan, this is an angiotensin receptor blocker. You may have noticed، ممكن تكونوا لاحظتوا ان ال AT او ال angiotensin receptor مكتوب جنبه number 1. This is because the angiotensin 2 receptor for the angiotensin 2 So the mediator name or the vasoactive peptide is called angiotensin 2. Okay, the octapeptide. This angiotensin 2 has two types of receptors. Angiotensin 2 type 1 receptor and angiotensin 2 type 2 receptor. We are concerned here, or what we want to block here, is the angiotensin 2 type 1 receptor. That's why we have this small subscript 1 on the name of the receptor. عشان كده عندنا ال AT1 receptor. طيب ده شيء مفهوم، واحنا خلاص عرفناه من المرة اللي فاتت ان انا اقفل ازاي الرنين انجيوتنسين الدوستيرون سيستم ب ACE inhibitor او بانجيوتنسين ريسبتور بلوكر. طب مين تاني؟ I can inhibit renin secretion. I can inhibit renin secretion. مين اللي كان بينهبت renin secretion if you can remember sympathetic depressants, beta 2 blockers, okay, beta 1 blockers, beta blockers I mean beta 1 blocking of beta 1 and alpha 2 agonists. So it can inhibit renin secretion by using a beta blocker through beta 1 action. يعني لما بقفل البيتا 1 ريسبتور بالتحديد بقلل الرينين سكريشن، لان البيتا 1 ريسبتور ده موجود على الجوكستا جلوميرولار اباريتس في الكدني، وعلشان كده لما بقفل البيتا 1 ريسبتور بقلل الرينين برودكشن. وكذلك الالفا 2 ريسبتور برضو موجود في نفس المكان، ولما بحفز الالفا 2 ريسبتور او بستيميوليت الالفا 2 ريسبتور بقلل الرينين برودكشن. يبقى الفا 2 اجونست او بيتا بلوكر، سبيشالي بيتا 1 بلوكر، ده بيتا 1 اكشن. كمان انا ممكن اقفل الستيب بتاعت الرن. احنا الستيب بتاعت الرنين دي we never touched it. الرنين دوت ما انا ممكن اتصرف فيه برضو. الرنين دوت which converts angiotensinogen to angiotensin 1 I can block its site of action. Blocking the site of action, we call it blocking renin receptor by a drug called enalkyrin. So there is enalkyrin which is a renin receptor blocker. enalkyrin وفي كمان الاسكايرين وفي enalkyrin which is a renin receptor blocker. So this is the diagram that we studied before, and I have put arrows on the sites where we are going to block the renin angiotensin aldosterone system. Let's take them from the arrow at the very left. The arrow at the very left اللي على الشمال خالص ده هيقفل الرينين برودكشن من عند الجوكستا جلوميرولار اباريتس. يا ترى ده يكون مين؟ ده هيكون طبعا الفا 2 اجونست او بيتا بلوكر. طيب يا ترى مين الارو اللي بعده على طول؟ ده الارو اللي هو هينهبت الرينين. وات انهبتس رينين؟ اللي كل اسمه الدواء اللي اسمه انالكايرين. انالكايرين will inhibit الرينين ريسبتورز او السايت اوف اكشن اوف ذا رينين. بعد كده يا ترى مين اللي هينهبت ال ACE انزيم اللي هو اللي بعده بقى اللي على يمينه؟ ده الكابتوبريل والإنالابريل واللايسينوبريل اللي هما ال ACE inhibitors. طيب الآخر بقى سهم خالص على ايدنا اليمين خالص، أقصى اليمين to the very far right we have the angiotensin 2 receptor blockers, drugs that block the angiotensin 2 type 1 receptors اللي هما اللوسارتان والكانديسارتان والفالسارتان والتلميسارتان. طيب now we're done with the vasoconstrictors and we're shifting to the other vasoactive peptides, but they are vasodilators this time. We shift to the kinin system. And the kinin system just like الانجيوتنسين كان ليه precursor اسمه angiotensinogen، انا عندي هنا precursors بيشتغل عليها الكاينين سيستم اسمها الكاينينوجينز. يعني هنا البريكورسورز او البروتينز الكبيره اللي هيشتغل عليها السيستم ده اسمها ايه؟ كاينينوجينز. عندي something that's called high molecular weight kininogen and low molecular weight kininogen. The high molecular weight kininogen mainly present in plasma, okay, وال low molecular weight kininogen present in tissues. عندي enzyme اسمه ال prekallikrein enzyme which is activated by factor 12A into kallikrein. So this kallikrein enzyme is the enzyme that's going to activate the kinin system. الكاليكراين enzyme ده بقى هيعتمد لو هو في البلازما it will work on the high molecular weight kininogen يحوله إلى براديكاينين، ولو هو في التيشوز هيشتغل على اللو molecular weight kininogen يحوله إلى لايسينايل براديكاينين و another name كاليدين. يبقى ايه؟ يبقى انا عندي هنا شويه اسامي بس محتاجه احفظهم. اوكي، اللي هم مين؟ يهمني منهم مين؟ اهم اسم طبعا هحفظه هو البراديكاينين، اللي هو انا اصلا عايزه اوصل له، اللي هو اصلا الفازودايليتور بيبتايد بتاعي. طب البراديكاينين ده موجود اصلا في البلازما، لكن في غيره موجود في التشو اسمه لايسينايل براديكاينين او كاليدين. اوكي، طيب والاثنين بيتصنعوا بايه؟ بيتصنعوا بانزيم اسمه كاليكراين انزيم، والانزيم ده موجود في ان اكتيف فورم اسمه بري كاليكراين. لما يبقى اكتيفيتد ويشتغل في البلازما يطلع لي براديكاينين، في التيشوز يطلع لي كاليدين او لايسينايل براديكاينين. طيب يشتغلوا على ايه بقى الكاينينز ديت؟ البراديكاينين والكاليدين دول يشتغلوا على بي ريسبتورز. وهنا الحقيقه انا سعيده جدا ان احنا نوصل للنقطه دي، لان a lot of people they write B and they mean beta. The receptors in the sympathetic nervous system of the autonomic nervous system, they are not called B, they are called beta. So either you write it as beta, as the symbol beta، يعني تكتبها وهي باينة انها beta symbol، يا اما تكتبها beta B E T A، يا اما ما تبقاش صح، لان قدامنا اهو ان B this is another receptor. يعني البي ده this is a symbol for a totally different receptor, which is the receptor for bradykinin. And again there are two types. There is a B2 and there is a B1, okay, type of receptor. These are both are G protein coupled receptors. الاثنين بيشتغلوا من خلال الجي بروتين، بس B1 is inducible و B2 is constitutive. What does it mean constitutive and inducible? Constitutive is a receptor which is tonically active. الريسبتور دوت هو شغال كده بنفسه، يعني الاكشن بتاعت الريسبتور ده this is a part of our physiology. It's maintaining our normal function. It's maintaining our normal balance. So when I say a certain receptor or enzyme is constitutive, I mean that this receptor or this enzyme is active by itself, and it's active tonically, and it's active in a basal way. It is active all the time because its activity is part of the balance of our physiology. It has to be active all the time. When I say that this receptor or enzyme is inducible, which means that its activity increases in certain situations. Its activity is not that high under basal conditions. So bradykinin is more active on constitutive receptors, okay, which is the binding of the B2 or B2 receptor, which is more constitutive. طيب, so what do we need to know about kinins in short كده? We need to know their names. خلاص, we already know their names: bradykinin, lysinal bradykinin or calidin. We need to know about their receptors. Okay, the receptors, and we already know they act on G protein coupled receptors called B1 and B2, and B2 is the constitutive one, and it is more for bradykinin. However, calidin binds equally with B1 and B2 receptors. Number 3 to know about kinins. الحاجة الثالثة اللي أنا عايزة أفهم عن الكاينينز are their actions. طب الكاينينز دي هتعمل إيه؟ We already have a clue. هو البراديكاينين ده كان قلنا بيعمل إيه؟ هو لما كان ال ACE بيكسره، كان بيكسره ليه؟ لأن هو powerful vasodilator. So it is a very powerful vasodilator. It produces vasodilatation through B1 and increased vascular permeability. And it also produces increased smooth muscle contraction, bronchoconstriction, uterine contraction, and it results in sensation of pain. So these bradykinin and calidin, they appear to be inducers of inflammation. Okay, and they are very active during inflammatory process, وكمان they are active in cases of bronchial asthma because they are responsible for bronchoconstriction. They may also produce uterine contraction, but most importantly smooth muscle contraction and bronchoconstriction, and the production of pain and vasodilatation increase capillary permeability. طيب, we said we're going to know 4 pieces of information. هنعرف 4 حاجات عن الكاينينز. أول حاجة أساميهم براديكاينين وكاليدين بيتعملوا إزاي وكده عرفنا. تاني حاجة receptors B1 و B2 ومين constitutive ومين inducible. تالت حاجة الأكشنز عرفناها vasodilation increase permeability وبرونكو constriction أساسا وproduction of pain. طب يا ترى إيه الابليكيشنز بقى؟ تفتكروا أنا حابة أحفز الأكشن ده ولا أعمل له inhibition؟ Do I want pharmacologically to enhance this action of bradykinin or to limit the action of bradykinin? It looks like I will try to limit the action of bradykinin. Aspirin, protein, they inhibit the kallikrein system and they decrease the synthesis of kinin, and we know that aspirin is an anti-inflammatory. يبقى when we take aspirin which is acetylsalicylic acid, this is an anti-inflammatory drug. Now how does it reduce inflammation؟ ازاي الاسبرين بيقلل الانفلاميشن؟ بان هو بعض من الاكشنز بتاعته، واحد من الاكشنز بتاعت الاسبرين ان هو it inhibits the kallikrein system and decreases the synthesis of kinins. اللي بيشتغل شبه الاسبرين في الاكشن ده something that's called a protein. So when we take aspirin has a lot of actions. aspirin بيعمل حاجات كتير. هناخد الاسبرين it inhibits something called the cyclooxygenase enzyme. بس مش ده الاكشن الوحيد بتاع الاسبرين كمان ممكن to inhibit the synthesis of kinins. الكاينينيز enzyme is very active اللي هو الangiotensin converting enzyme. That's why these bradykinin and calidin they have a very short duration of action. وإلا كان كلنا يبقى عندنا vasodilation ويبقى عندنا increased capillary permeability من أقل حاجة and we enter in shock. Angiotensin converting enzyme is the kinase 2 enzyme. اوكي طيب ال ACE inhibitors تفتكروا بقى هتعمل ايه؟ ال ACE inhibitors they will inhibit الانجيوتنسين converting enzyme، يقللوا الانجيوتنسين 2. احنا اتفقنا اللي ماشي معاه بالعكس مين؟ البراديكاينين. يبقى ما الانجيوتنسين 2 هيقل البراديكاينين هيزيد. نفتكر كده على الدايجرام. Let's remember the diagram that showed us the yellow box with the angiotensin converting enzyme which results in more angiotensin 2 and less bradykinin. And so when you inhibit the angiotensin converting enzyme by captopril, enalapril, lisinopril, you are going to inhibit this enzyme, you're going to reduce angiotensin 2 and you are going to increase bradykinin. That's why people taking angiotensin converting enzyme inhibitors like captopril, enalapril, lisinopril, people taking these drugs, they may have increased level of bradykinin. They may have cough as a side effect. يعني واحد مريض بياخد كابتوبريل أو إنالابريل أو لاسينوبريل لعلاج الضغط for hypertension. They complain of cough. Okay, and maybe angioedema, which is edema of the soft tissues of the face and the larynx. Okay, so if they have this angioedema, it will be due to what? Due to increase in bradykinin, in which case we can change these drugs because this is not a very good side effect. So how to inhibit the calidin or the kinin system? How to inhibit the kinin system? We inhibit kinin system by aspirin and by a protein which inhibit the synthesis of kinins. But we have to remember that the ACE enzyme is the same as the kinase 2. It metabolizes the kinins, and so patients taking ACE inhibitors, اللي ياخد ACE inhibitors, captopril, enalapril, lisinopril, they may have increase in the bradykinin level. So what are the actions of kinins? They stimulate B1 and B2 receptors coupled to G proteins. They produce powerful arteriolar dilatation 10 times more than histamine. They stimulate B receptors and increase prostaglandin, decrease the blood pressure, producing redness and hotness. They produce vasoconstriction of the veins. Okay, they contract the blood vessels or the smooth muscles of the walls of the veins. So if you contract the veins, you're going to somehow increase the venous return to the heart. So you're going to shift the blood from the veins to the arteries. Now, what you done in the arteries? You have produced dilatation of the arteries and increased permeability. So this is going to give more and more edema formation. So vasoconstricting, vasodilatation on the arterial side with vasoconstriction on the venous side, this is going to increase the pressure, and it's also going to, first of all, increase the venous return to the heart. Okay. Second, it's going to perform back pressure on the capillaries. the way of the capillaries will be blocked. هيبقى في hydrostatic pressure back على الكابيلاريز، يقوم ده مع increased capillary permeability will increase edema formation. So dilatation of arterioles, constriction of veins, increased capillary permeability. So the blood going from the arteries to the capillaries is going to increase. The blood leaving the capillaries and going to the veins is going to decrease. The capillaries are going to be dilated. This will all result in edema formation. Also, they will result in pain, and they mediate inflammation and maybe anaphylaxis. Anaphylaxis is severe allergic reaction accompanied by hypotension and marked decrease in the blood pressure and maybe even syncope and coma. Tachycardia, direct effect on the heart, reflex from the hypotension, and spasmogenic effect on smooth muscle, they produce bronchospasm. So now we shift to another station, which is the station of free fatty acid derivatives or eicosanoids. So these are all products of a long chain polyunsaturated fatty acid, which is called arachidonic acid. They are, this arachidonic acid consists of 20 amino acids, and this arachidonic acid receives oxidation. It will undergo oxidation at multiple or different sites to produce different prostaglandins. So what does it mean? Oxidation means there will be double bonds. Okay, so there will be double bonds. This means that the products will be unsaturated or polyunsaturated fatty acids. Okay, polyunsaturated fatty acids. So eicosanoids are derivatives of arachidonic acid, which consists of 20 carbons, and this is the mother compound. This arachidonic acid will undergo multiple oxidations, which means there will be double bonds introduced at multiple positions, and introduction of these double bonds will produce polyunsaturated long chain fatty acids that will be called eicosanoids. The initial rate limiting step in their synthesis is the liberation of arachidonic acid from the membrane phospholipids. This arachidonic acid is a fatty acid. Where do we find it? We find it in the phospholipid of the cell membrane. Our cell membrane contains phospholipid, and arachidonic acid comes from the phospholipid of the cell membrane. And either undergoing one-step process or two steps, we are going to synthesize different prostaglandins. In the old version of your book, there were details about the one-step process and the process that goes in two steps, but for you, you're not required to know details about these steps. So this arachidonic acid now is liberated. This arachidonic acid is going to undergo oxidation. So oxidation goes by either cyclooxygenase or lipooxygenase. So this arachidonic acid is going to take one of two pathways, either the cyclooxygenase pathway or the lipooxygenase pathway. The cyclooxygenase pathway is going to get us prostaglandins. Lipooxygenase pathway is going to get us compounds called leukotrienes. So prostaglandins and thromboxane and leukotrienes are all important products that we need to know about in this session. So this is a diagram showing us what we described right now. What you see in the top of the diagram is the lipid bilayer. This is our cell membrane, and the cell membrane will contain arachidonic acid, which is esterified with the membrane phospholipids. Now there is a liberation of arachidonic acid. There is the enzyme responsible for this is called the phospholipase A2 enzyme. This enzyme is important. You need to remember the name of this enzyme. So phospholipase A2 enzyme, what it does is it liberates arachidonic acid. الفوسفوليبيز A2 enzyme ده بيعمل ايه؟ بيطلع الارachidonic acid من الفوسفوليبيد membrane يطلعها free inside the cell. Here بقى الارachidonic acid اللي بقت موجودة دلوقتي ممكن يشتغل عليها one of two main enzymes. اوكي، في حاجه اسمها السيتوكروم P450 ممكن يشتغل على arachidonic acid, but we are concerned in this session by the other two enzymes, the lipooxygenases and the cyclooxygenases. If this arachidonic acid goes through the lipooxygenase pathway, it will get us leukotrienes. If it's going to pass through the cyclooxygenase pathway, it's going to get us prostaglandins, prostacyclin, and thromboxane. So this is the pathway from the beginning. Now, this diagram shows us, of course, you're not responsible to memorize this. This is basically for reading. This shows us more detailed steps in synthesis of prostaglandins. And we can see, all I want you to know here, that you have a lot of types or many types of prostaglandins. There are many types of prostaglandins, as you can see, and some prostaglandins may be precursors of other prostaglandins. We have prostaglandin thromboxane E2, prostaglandin E2, F2 alpha, D2, I2. So these are all prostaglandins, and with very slight differences in chemical structure of these prostaglandins, we get different actions in our bodies. This is another diagram that is summarizing the metabolism of arachidonic acid. Now we know this arachidonic acid comes from the phospholipid membrane. This arachidonic acid may pass through many pathways. In the CNS, arachidonic acid may give rise to cytokines, or in the CNS by cytokines. In the presence of cytokines, arachidonic acid will be metabolized by cyclooxygenase 1 and 2 enzymes and will liberate prostaglandin E2 inside the CNS. Now, prostaglandin inside the CNS, they mainly result in fever and pain and perception of pain. So the increase in prostaglandin E2 inside the CNS will result in fever and pain. Now, in the lung, in bronchial asthma, the arachidonic acid passes through the lipooxygenase pathway, and it liberates something called the leukotriene C4 and leukotriene D4, which this is the lipooxygenase pathway, and that's how in bronchial asthma there is bronchoconstriction, mucus secretion, edema, and eosinophil migration. Generally speaking, in inflammation through the enzyme cyclooxygenase 2, cyclooxygenase enzyme type 2, we get prostaglandin E2 and I2, resulting in vasodilatation, increased vascular permeability, and increase in cytokines, and again pain. So this diagram, what does it want to say, to tell us? It tells us that how the metabolism of arachidonic acid will contribute to different pathologic processes we have in our bodies. يعني الدايجرام ده بيقول لنا ازاي الارachidonic acid بيدخل في مشاكل بتحصل لنا في diseases مختلفة. الارachidonic acid بيدخل في البين. ازاي بيدخل في البين؟ الارachidonic acid metabolism عن طريق metabolism by cyclooxygenase ممكن تكونوا عرفتوا دلوقتي cyclooxygenase نوعين، cyclooxygenase 1 و cyclooxygenase 2. فعن طريق metabolism بالcyclooxygenases الارachidonic acid هتطلع لي prostaglandin E2 في البرين، يعمل لي rise in temperature ويعمل لي pain. فده الابليكيشن بتاع الارachidonic acid metabolism في البين والفيفر. ممكن كمان مهم قوي الارachidonic ميتابوليزم في حالات البرونكيال ازمه، لان هو في حالات البرونكيال ازمه الارachidonic اسيد بتمشي لايبوكسجينيز باثواي تطلع لي كوتراين C4 ودي 4، ودول بيعملوا لي برونكو كونستريكشن وانكريس سكريشن وإديما ويعملوا اتاك برونكيال ازمه. للناس اللي ما يعرفوش برونكيال ازمه هو الربو الشعبي. In this disease the patients have repeated attacks of bronchoconstriction and it may be severe and sometimes it may be fatal and it's a chronic disease and it's a very important disease to control. كمان arachidonic acid metabolism هو مهم في الانفلاميشن اللي هو أساسا عن طريق السايكلوأكسجينيز type 2 enzyme، لأن this is the inducible form of the enzyme. It's not constitutive, it's inducible. بيبقى induced إمتى؟ بيكتر إمتى؟ in occasions of inflammation. في الحالة دي يطلع لي prostaglandins من أنواع E2 و I2 يعملوا لي vasodilatation ويزودوا capillary permeability و increase cytokine و leukocyte migration، وده يعمل لي picture of inflammation. So the products of the cyclooxygenase pathway احنا اتفقنا arachidonic acid يا تمشي cyclooxygenase يا تمشي lipooxygenase pathway. Cyclooxygenase enzyme بيتكون from 3 types. There are 3 types of cyclooxygenase enzyme. Cyclooxygenase 1, it's a constitutive enzyme. It's always present. وده مهم ليه physiologic functions. Cyclooxygenase 2, it's the inducible form of the enzyme. Means that it increases and decreases in certain situations. When does it increase? It increases by inflammatory stimuli. لما يكون في inflammation يبقى في elevated production of prostaglandins in inflammation. أما cyclooxygenase 3, it's a form of cyclooxygenase 1, okay, and it's found in the brain and in the heart. This slide summarizes the types of prostaglandins. So there are mainly 5 classes of prostaglandin receptors. Okay, وكل البروستاجلاندين receptors are G protein coupled receptors. أنا عندي ال DP. Okay, this is the receptor for prostaglandin D2. FP is the it's the receptor for prostaglandin F2 alpha. IP is the receptor for prostaglandin I2. اوكي، او بنسمي prostaglandin I2 by the way prostacyclin. يعني prostacyclin هو نفسه ال I2. ال EP is the prostaglandin receptor for the receptor of the prostaglandin E2. It's the receptor prostaglandin E2, and the TP receptor, it is the receptor for thromboxane A2. So يعني القاعدة العامة إن أنا عندي أنواع مختلفة من البروستاجلاندينز زي ما أنا وريتكم قبل كده, or as I showed you there are different types of prostaglandins. So maybe to put you on on the same page or with me, or to put you in context علشان نحطكم في الصورة. أفكركم أنا كان عندي arachidonic acid بتبقى liberated من الفوسفوليبيد membrane بالفوسفوليبيز A2 enzyme. بعد كده تدخل one of two main pathways, يا إما cyclooxygenase pathway يا إما lipooxygenase pathway. lipooxygenase pathway كان بيطلع لي حاجة اسمها ليكوتراينز. من الليكوتراينز اللي ذكرناها في السلايد اللي فات حاجة اسمها ليكوتراين C4 وليكوتراين D4, ودول كانوا مهمين in cases of bronchial asthma اللي هم بيعملوا bronchoconstriction increase secretion وإديمة. يا إما الأراكيدونيك أسيد تمشي السايكلوكسجينيز باثواي. السايكلوكسجينيز باثواي تقوم تطلع لي بروستاجلاندينز. السايكلوكسجينيز باثواي دوت كان في تايبس من السايكلوكسجينيز انزيم. الكونستيتيوتيف منهم كان اسمه سايكلوكسجينيز 1, والانديوسبل كان اسمه سايكلوكسجينيز 2. طيب كان مهم في امتى؟ كان السايكلوكسجينيزز دي بتطلع لي بروستاجلاندينز ممكن تو ميدييت انفلاميشن اوكي او تميديت بين. وكمان البروستاجلاندينز دي ليها فانكشنز تانية مهمة في الجسم غير انها بتميديت بين وانفلاميشن, ليها فيسيولوجيك فانكشنز. طيب يبقى احنا كده وصلنا للبروستاجلاندينز. فالبروستاجلاندينز دي اللي بتطلع من السايكلوكسجينيز انواع. عندي بقى بروستاجلاندين D2 وعندي بروستاجلاندين E2 وعندي بروستاجلاندين F2 ألفا وعندي بروستاجلاندين I2 وعندي ثرومبوكسين A2. دي كلها أنواع من البروستاجلاندينز اللي طلعت منين؟ من الأراكيدونيك أسيد لما الأراكيدونيك أسيد اشتغل عليها السايكلوكسجينيز إنزيم. طيب بروستاجلاندينز دي بتشتغل على ريسبتورز. القاعدة العامة إيه؟ لما يكون اسمه بروستاجلاندين دي يبقى الريسبتور بتاعه اسمه DP. لما يكون اسمه بروستاجلاندين F يبقى الريسبتور بتاعه اسمه FP. لما يكون اسمه بروستاجلاندين I يبقى الريسبتور بتاعه اسمه IP. ده غير بقى ان ال EP receptors اللي هي belong to the prostaglandin E2 دي بقى انواع كتيرة من الريسبتورز. عندي ايه؟ عندي 4 subgroups EP1 2 3 and 5. كمان عندي ثرومبوكسين A2 ل TP receptors. تمام. This is a summary okay of the products of the cyclooxygenase pathway. عندي cyclooxygenase ممكن يبقى cyclooxygenase 1 أو cyclooxygenase 2. الcyclooxygenase 1 is constitutive وده موجود في البليتلتس وكمان بيعمل vasoconstriction. والcyclooxygenase 2 is expressed during inflammation وبيعمل vasodilatation وبس ده بيعمل لي برضو gastric protection. النون ستيرويدال انتي انفلاماتوري دراجز بقى دي الادويه اللي احنا بنستعملها كل يوم لعلاج الانفلاميشن وعلاج الصداع، اسمهم نون ستيرويدال انتي انفلاماتوري دراجز. ليه؟ لان هم بيقللوا الانفلاميشن لكن هم مش كورتيزون. يبقى كورتيزون ده هو اساس الايه علاج الانفلاميشن. لما يكون عندي ادويه ما هياش كورتيزون بس بتقلل الانفلاميشن نقوم نسميناها نون ستيرويدال انتي انفلاماتوري دراجز. هذه النون ستيرويدال انتي انفلاماتوري دراجز هي بتشتغل ازاي؟ عن طريق inhibiting السايكلوكسجينيز انزيم. ممكن تو inhibit cyclooxygenase انزيم 1 و2 بشكل non selective، وممكن في non steroidal anti inflammatory drugs بتinhibit بس ال inducible COX enzyme أو type 2 COX enzyme. So this is the end of this session, which is the third session about Autacoids. We thank you for listening and we'll continue with the last session with the rest of the talk about the eicosanoids. Thank you.